morning everyone. Welcome to BMC Global Live Al-Hilal Health World, Nothing But Lifestyle. I'm Anupama Menon. Good health is the greatest gift of all. In this talk show Health World, we have expert doctors from various fields providing valuable information to assist you all on your journey towards good health. Today, we're delighted to have with us Dr. Reema Sharma Dhar, specialist pedodontist from Al-Hilal Hospital in Rifa. She comes with an experience of over 15 years in this field, and today's topic of discussion is injury to teeth in children. So let's move over to her. Thank you for joining us on the show, doctor, and welcome to the show.
Thank you so much, Anupama, and very warm regards to all the viewers, and a good day to everybody who are watching the show, and happy to be here.
Nice, our pleasure. So, doctor, how and what kind of injuries do happen to children when it comes to their teeth? What are the problems that they normally face?
Okay, see, dental injuries or injuries to the teeth can be broadly divided into three categories. First of all, there could be a fracture of the tooth, that is a part of the tooth can break. The second is the tooth itself can move. These are called luxation injuries, where the impact is more on the gums or the supporting structure of the teeth.
Okay.
So the teeth itself can move. They can move in any direction. They can move out, in, up. And the third type of injury is where there is a greater impact to the entire jawline and everything, jaw structure and all, which are more complicated injuries, which can also result in loss of a tooth, and they often need more comprehensive management and all. So this is the three type of injuries that can happen. Now, where the injury can happen and how it can happen at anywhere. I mean, we have injuries happening at the home, which are very common, especially for younger children. Toddlers who've just learned to walk, they are on the move, yes, and they have not yet got the coordination. That is the most common age, between 2 to 3 years, when the toddlers are learning to walk, learning to run, yes, where the coordination is, they have not yet perfected the coordination, and they are trying to explore. They will, they are the ones when parents will come and say they love jumping from the sofa, jumping from the bed. So at that age, most of the injuries that happen in the confines of their own homes.
Yes.
For older children, 7 to 9 years of age, there are a lot of playground related injuries. The playground related injuries, they are injuries which are associated with certain sports, and or sometimes in school due to getting into fights and all, which is there again in teenage children, which is more common.
Okay, and in your observation, how common is it? Like, do you come across a lot of cases like this, or?
See, overall, the prevalence, or what we say, that number of children, percentage of children who get injuries. So, if you say there are different studies and all which are there. So, the ratio is always between 10% to as high as around 20%. Some studies, there are different age groups according to, like, younger children. There are different, around 10% of children will face some kind of dental injury. It could be minor, it could be major, it could be so minor that the parents have not even noticed it. And then the older children have a percentage of around 15%, which involves, and as above 20, the percentage of the percentage of young adults who get injuries, it keeps on decreasing. And in that age, more injuries are due to road traffic accidents.
Okay. And as you mentioned earlier, it's most likely to happen in the confines of the homes
for the younger children. Yes, definitely.
And as a parent, I'm sure any parent facing this kind of a situation would go into a panic mode, seeing your child fall and, getting injury to the teeth. So in your opinion, what should ideally a parent do when such a situation arises in the house?
See, first of all, the most important thing a parent can do, and which is very difficult to do, is to not panic. Okay,
stay calm. That's the most difficult
because
part,
because your child is already bewildered.
Yes.
They may be bleeding. Because if the child has fallen down, they may cut their lip, they may cut their cheek. They may be, if they've fallen on an edge, sometimes the whole cheeks gets abraded.
Okay.
Or if they have injured themselves with a toy, that also happens when the mouth is bleeding. And oral injuries or injuries to the face, they bleed a lot. So sometimes they appear more severe than they are. Okay, so the first thing that you need to do is just look around and see what the child has injured himself with or herself with.
Okay.
Second is, you have to try to arrest the bleeding. Now, arrest the bleeding is Very simple. All you need to do is take a clean cotton cloth. You can wet it if it is nearby, and just apply a little bit of pressure.
Okay.
Okay. Ideally, any bleedings, if they are not stopping within 5 to 7 minutes, 7 minutes, then you need to consult a doctor immediately.
Okay.
Okay. Secondly, if the bleeding has stopped and the child has stopped crying, then do ask the child to open the mouth and examine that if all the teeth which were present already. See, why I say which were present already, because in the age group of 1.5 to 2 years, their teeth are still erupting.
Okay.
It's by the time the child is 3 that all the milk teeth are present, all the 20 milk teeth are present in the mouth. So just parents, normally the mothers or the primary caregivers, they have an idea what tooth has come for the child and all. So just count the teeth, if all the teeth are present or accounted for. Okay. And if you see that some teeth has been knocked out, or it's, do not try to reposition, do not try to do anything. You have to bring the child to a dentist. You have to bring the child to a dentist. Now the other thing over here is, if the child has fallen down supposedly from a swing, or he has been pushed by another child, and first thing you have to see if the child is, did the child lose any consciousness?
Okay.
Is the child breathing properly? If the child has lost consciousness, or you are not aware that how the child fell down, how the child has injured himself, then the first thing as a parent you have to do is, even if the child is appearing normal, but if the child is vomiting, if the child is nauseous, if the child is feeling like pain, complaining of pain in the ear, complaining of pain in the head, after an injury, you have to take the child to the emergency services. You have to consult a doctor.
Okay.
Because you don't know, if you are not present to see the injury, if you have seen the fall, if you've seen the injury, you know what has happened.
Exactly. So as a parent, it's very important to assess the nature of the injury.
If you can,
and how the
it
child
helps us, because we will also ask you the same questions.
Same questions, yes.
We will ask you, because it will help us in formulating the treatment plan and what we need to do. The primary concern for a parent and a child at that age, at an early age, is to first to relieve the child of pain. Because the child is having pain. So that is our primary concern. The second is to prevent any injury to the permanent tooth germs.
Okay.
Now what I mean by permanent tooth germs are, these are the tooth germs these are the tooth buds which are developing in the gums, in the bone. They have not yet erupted at this age. So we have to preserve them. We want no injury to them.
Okay. So the parents should also keep an eye on how the child is reacting, maybe responding, whether the child is nauseous. So these are the signs to look out for.
Is the child conversing properly?
And
then means it's, thank God it's a superficial injury which can be taken care of.
Okay. And what if this happens late in the night and a dentist is not available at that point in time?
See, if the dentist is not available, and if there is bleeding, if the tooth is, if there is a cut, if there is a laceration, you have to take the child to an emergency services doctor.
Okay.
They will be able to provide the first aid which is needed, and then you can follow up the next morning with your dentist.
Okay. And let's say a fall happens, and the child seems to be perfectly fine at that time, but maybe after 2 or 3 months, can something crop up at a later stage because of the impact of the fall? What should parents look out for?
See, normally this is always a standard advice which you give to all parents. If the child has fallen down, or if the child has managed to hurt himself, he cries for some time, then he is fine. He is apparently fine. The tooth also appears fine. The gums also appear fine. You may notice that there may be a little bit of gum bleeding. But please bring the child within the next few days, or ideally the next day, just for a checkup. We will be able to assess if there has been any damage, because sometimes even a minor luxation injury or a minor movement of the teeth may happen, which may be affecting the bite of the child, which you as a parent may not have noticed, but we may be able to notice. We may be able to do some correction for it if needed. We may be able to reposition the tooth if needed, and we need to follow up after a week, then again after 2 weeks, and then after 6 months. This is a standard for any injury to the tooth, whether it is a fracture, like by fracture I mean a portion of the tooth has broken off, or whether the tooth is itself moved, or the tooth has been pushed inside and everything. So why we mean by about follow up is that because in a lot of cases of injuries, initially the teeth may be fine, but over the next few months, there may be a slight discoloration in the tooth.
Okay.
There may be a brownish or a grayish discoloration in the tooth, and then which will indicate that there is bleeding inside the tooth, and the tooth may become dead.
Okay.
And they may have a small boil developing on the gums, or the child may start complaining of pain. This is one thing that happens following trauma. Even after, if a tooth has been fractured, a portion of the tooth has been fractured, you may think it's milk teeth, we don't need to do anything about it. Right now the child is not having any pain, but if no restoration is done over it, we are basically allowing for all the bacteria and whatever the child is eating, all the saliva to be going inside the inside the pulp chamber of the tooth. So a filling may need to be done.
Okay, so
even
ideally
in the milk
child
teeth,
should be taken to the dentist.
You have to bring whenever it is convenient for you.
Yes.
Definitely, if there are any other injuries, those injuries will take precedence if above the dental injury. But if there is a dental injury, you should consult.
Yeah, I think dentist is the best person to assess the nature
To
of the injury.
To assess the nature and what is to be done.
Yes, and you also spoke about milk teeth. So what needs to be done if a milk tooth is chipped off, or if it's...
See, it depends on how much of the injury has happened. If there is a small break or a small fracture, we may need to do just a little bit of rounding off, so that there are no sharp edges which will cut the lip or which will injure the lip. If there is a bigger portion which is chipped off, then sometimes parents come to us, the child has fallen, and they will come with the broken piece. Broken piece.
Yes.
So this is something you should, as a parent, you can look around at. If you see the tooth is broken, and if you can see, and we can reattach with using composite resins.
Even the
and
milk
all.
teeth,
it can be reattached and everything. If there is no damage.
Okay.
If the tooth is broken in such a way that there is bleeding from the teeth, or the child is complaining of pain, or there is too much sensitivity to air, we may need to do sometimes a pulpotomy or a deeper treatment. That depends on the age of the child and the status of the root. Now, in children, normally if a child has fallen around 3 years, normally the permanent teeth will be coming only after 6.5 to 7 years.
Yes.
So we have to preserve, we have to try to see that is the only front teeth the child is going to have. And now we can do, even if a pulp treatment is needed, we can do a pulp treatment and follow it up with aesthetic crowns.
Okay.
So that will preserve the smile and the function of the tooth.
And what if the tooth comes out completely?
See, that is if the injury has happened, and if the tooth comes out completely, one thing we say is, please do not try to place the tooth in the child's back, especially for children. Especially for milk teeth, please do not try to do it.
Okay.
But if possible, do get the tooth when you are coming to visit the dentist. You can get it in saliva or in milk or coconut water, whatever is available easily in a small container or a Ziploc bag.
But water is not advised?
Not tap water.
Okay.
If nothing else is available, you can always use
so
tap
ideally
water.
Saliva, milk,
and coconut water. You have coconut water.
Okay.
So you get that. The reason why is we are also, unless the child is very, very young, and if we assess with an X-ray, we may need to take an X-ray to see what is the status of the developing tooth and everything. We are not going to re-implant it. But the reason we want to see the tooth is, has it fractured? Because sometimes part of the tooth will come out, and the part of the tooth is still inside the socket. So we want to see if it is intact. That's the thing. For permanent teeth, we follow the same thing, and if for older children, they will sometimes place the teeth themselves in the socket, which is a good thing. But then sometimes it happens that they have not placed it properly, and the tooth has fixed in that condition also.
So parents should actually carry the tooth when possible,
carry the tooth
to the doctor,
and holding the tooth always with the crown portion. The crown portion is the portion of the tooth
that has to be kept in mind.
16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
So, doctor, I'm sure a lot of parents have this question in mind: can a shaking tooth be saved after fall? Is that possible?
So, see, now, as I said, firstly, shaking teeth can definitely be saved depending on the age of the child, depending on the extent of injury, and if it is a primary teeth, if it is a permanent teeth. Now, for primary teeth, for a young child, if it is minor movement is there, definitely it can be saved. We do a procedure called, after assessing that inside there is no fracture or anything, then we do something called a splinting. Now, a splint, like in layman terms, splint is something which will prevent unnecessary movement and stabilize the teeth and give support. So, these are the three functions of a splint. So, for children, splinting may be done if it is indicated in that particular case. In a permanent teeth, now it becomes an imperative. For a permanent teeth, it becomes imperative to try to save it, to retain it.
Yes.
So again, if there is the tooth has moved from its position, a tooth has been knocked inside, or there is a couple of teeth have, the child has fallen, a couple of teeth have moved and all. So we definitely, there is repositioning is needed. We may need to take an X-ray. We definitely need to take an X-ray to see if what is the status of the root, if there is any fracture inside, if any fragment is there and anything, and then we try to splint it. So there are different types of splints are available. You may have seen it. Some of them look like, if the child will look as if he's been wearing sort of braces. There will be a wire with a little bit of composite and all. So the child may need to have that splint on somewhere for 2 weeks to, in some cases, up to 4 weeks, and in cases where there are fractures, then in cases up to 4 months also a splint is indicated. That depends on the type of injury. But just because the teeth is shaking little, it does not mean that this teeth cannot be saved. Okay. Another thing, especially in younger children, is a lot of the time there will be a little bit of movement initially. There will be movement, bleeding and everything. So what we advise in cases like that, when there is only a very minor movement, we will wait and watch. We will observe the child. We advise any painkiller if it is needed. If the child has fallen in a playground, often some antibiotics are prescribed. Some antibacterial mouthwash for cleaning may be provided, because we will advise the parent not to brush for a few days, 2 to 3 days, and also to give soft diet. So sometimes if the movement is a very minor movement, it can the gums, it can auto resolve, as we say. In children who are like around 6 or 5, at that point of time, now we have to assess, because at that time already the milk teeth in some children is about to fall. So that we have to distinguish whether the mobility is because of the new teeth which is coming down and it is time for the milk to go, or because of the trauma there is more mobility. So in case of, there will be a different set of treatment which we have to follow depending on the age of the child, the status of the root development, how much time it is for the permanent teeth to come. So if for a 6-year-old child, when we know that normally between 6.5 to 7 years the permanent teeth will be coming out, and if the tooth is moving a lot, then we will suggest extracting the teeth.
So for children above the age of 7, for children who have already got their permanent teeth, so what if that permanent teeth comes off? How concerned?
This is permanent teeth being knocked out. This happens very commonly in children, either in playground when they are one of the most common thing is they're hit by the swing,
yes.
or in a cycle, and by cycling they fall on the face, or and skating when they fall, sometimes even it could be a cricket injury where they are hit on the face with the ball, so the tooth is knocked out. Now, and these cases, depending on the age of the child, we have to see whether the root is completed or root status is completed or not. First thing is, we will do, if the parent comes to us, they have to come as early as possible, like immediately. In the child has to be advised this. In the school, if it has happened, they have to go to the school nurse. Most of the school nurses are aware of what to do. If it happens to the playground, they have to pick the tooth again from the crown, try to pick it up from the crown. Do not try to wash it even if it has fallen into the playground or anything, because there are some living cells still on the root. We want to preserve the vitality, we want to preserve the tooth. So if the child comes to us within an hour of injury, like, it's the less time the tooth has spent out of the socket. Like, if within 30 minutes the parent can come, we have a much greater chance of success of eventually for the tooth. 60 minutes, 90 minutes. So whenever they will, we always advise as early as possible. Pick up the tooth, put it in saliva, milk or coconut water. Get to the dentist. We will try to always re-implant the teeth. Put it back in its position and splint it. This again is a follow-up treatment depending on the status of the root. There may be further treatment which will be needed after 2 days. We may need to do a root canal for the teeth later on. We may need to do a pulp treatment for the teeth. That depends on the nature of injury and the age of the child, the status of the root development. But if it is a permanent teeth, please be as early as possible. Please, if dentist is not available, take the child to the emergency services. If the tooth is broken off, if the tooth has, you feel that the root is there inside the mouth, the tooth has broken off. If the portion of the tooth has broken off, pick it up, please come. We will see if we can reattach the fragment. Sometimes also one thing that happens very commonly in older children is a portion of the tooth will break off and it may embed itself into the lip. There's an injury. So you see that there is a little bit of swelling. The child has also not realized what has happened. But if you see something like that, just when you are examining the child, also see if there is, if the child can say that, oh, my tooth broke off. Sometimes the children will say that I feel pain here. So in that case, that also happens, and we have to remove the fragment and see what we can do if there is a chipped off or if it has gone into the gums.
And what if the tooth turns grey? Is that a worrying sign?
Now, if the tooth after trauma, normally it happens. Like we say that initially the child has fallen. Sometimes the children will get hurt, and they will not especially older kids, they will not always tell the parent. They will not, if it is a playground injury or if it's they will not, nothing happened. But even with the minor injury, sometimes appearingly minor injury, the tooth may become non-vital over the time, and then that causes a greyish appearance. That causes a greyish appearance in the tooth. So please, it may need a root canal treatment. It may need to be treated endodontically. So
and can there be pain and swelling maybe a few days after the fall?
Yes.
Let's say immediately doesn't show up, maybe after a few days?
Yes, it is very much possible. If there is, it indicates there is an infection. There is any pain. Initially there may be no pain, there may be no bleeding, child may appear perfectly fine, and after a week or so they may develop a little bit of swelling, which is an indicative that maybe there is a fracture inside. Maybe the root has broken from inside, or maybe the tooth position has shifted and it is causing infection. So I may need to follow it up.
So doctor, before we wrap up, any advice to our viewers, especially the parents, to prevent dental injury so that they can also advise their kids accordingly, just to be on the safer side?
See, couple of things are there. Firstly, for the younger kids, especially there is a very common thing, children, like for the parents, what we always say, there are two types of injury. One is a fall injury, where the child has commonly fallen and stumbled upon something.
And this is not in their control
and it is not also in their control. Little sharp edges. edge injury with table, it's again very common. So rounded edges, you have edge protectors available, you have drawers, you have baby protectors which are available now, which is a very good thing and which can be used and everything. A lot of parents will, you know, they themselves from automatically they will carpet the house and everything to prevent that kind of thing.
Yes.
One thing that parents should be, when the children are playing, any toy that is, you know, this is normally for a child, this is the mouth opening size, okay, so any toy which is like around this size and everything, if the child is running with the toy, if they fall, they can hit themselves with it, and there is a very high chances of the teeth or the palate or the lips getting injured with it. So if the child is playing with a toy which is around this size, or sometimes with even cars, dinky cars, the metallic ones and all, better for an adult supervision to be there. Okay. We have to, this thing, no running with the toys which are, we have heard in our childhood, no running with this, no running with this, it works. Another thing is toothbrushing for little children. They often want to, you know, they want to be independent. So, but supervised brushing, and make sure that the area is a little dry, because even toothbrushing impact trauma can happen. And again, washroom is a place where they're wet and their tiles are there, so there's a greater chances of slippage happening. So supervision is the must. For older children who are there in sports, for children who are, especially who are playing, who are skating, or who are into baseball or everything, if the child is playing professionally, you can go for mouth guards which are available, you know. Mouth guards are available in the market. You have custom made mouth guards which are available in sports shops. You can also get a mouth guard made for your child specifically from a dentist shop. Another thing is, there is children, especially this is for permanent dentition children and all, children who have like a slightly proclined teeth, you know, the maxilla is more prominent, upper teeth appear a little forward and everything, they have higher chances of injury. So if you feel that your child has that kind of a profile, if you feel that the child is not able to close his lips above his teeth, like his lips are not competent, like the teeth protrude out, in that case, consult an orthodontist, consult a pediodontist, get the correction done, because that will reduce the risk of injury. So prevention, definitely, if possible, we have to teach as parents, we have to teach children safe behaviors. We cannot, as parent, one thing I will always say to all parents, okay, guilt is normal, you know, like when your child has got hurt, but it happens more commonly than we know. We can prevent it to some extent, and we can prevent the damage to a greater extent. So that is the important thing to it, that urgent emergency treatment can prevent long-term damage.
Thank you so much, Doctor, for those reassuring words, and thank you for taking the time out to be with us today. So friends, with that we come to the end of today's episode. So as Dr. Reema rightly mentioned, the first thing is stay calm, keep cool, and then take your child to the dentist as early as possible. There's a solution to every problem. Keep smiling, stay happy till we meet again next time. This is Anupama signing off. Good night. Don't forget to tune in to BMC Global Live Al-Hilal Health World every Tuesday at 8 p.m. Stay safe.